Hey, this is Dr. Padda, and I want to talk a little bit about arm pain. Arm pain is something that is sometimes very confusing for patients. Sometimes they come in with pain in their hands, sometimes it's in their forearm, sometimes it's all the way down from their elbow, sometimes it starts in their shoulders, sometimes it starts in their neck. And there's sometimes misinformation that patients have gotten, and I wanted to talk a little bit about the difference between carpal tunnel, cubital tunnel, and cervical radiculopathy, because there's a lot of overlap of symptomatology that can happen. The fact is that carpal tunnel syndrome is related essentially to a issue with something called a tendon sheath or a carpal tunnel retinaculum. There's a transverse carpal tunnel ligament in which your median nerve goes through, and it will make you numb from your thumb all the way to the middle of your forefinger. And what happens is that if you end up with a carpal tunnel compression at your wrist level, you'll appear to have a significant amount of numbness in your hand. And then you'll also notice that your thenar eminences right at the base of your thumb may end up getting weaker over time, and you may end up dropping objects. The key thing is that you get a compressed median nerve, and we have to decompress it. There's a whole host of methods that we use to decompress these median nerves. Obviously, the simplest thing is for us to change the biomechanics of how you use your hand and do physical therapy modalities and things of that nature. But the next step up from that is typically to do a carpal tunnel injection and then consider carpal tunnel surgery if needed. And there's a couple different ways that's done. Sometimes it can be done endoscopically, where we use a tiny scope to look in there, and sometimes you actually have to make a cut in the skin. So there's a couple different things that we worry about with regards to carpal tunnel syndrome. Now, the next thing that is often confused is something called cubital tunnel. And remember, carpal tunnel involved the median nerves, which was from the thumb to the middle of this forefinger. The ulnar nerve, however, which is part of carpal tunnel, which is separate from carpal tunnel, the ulnar nerve gets compressed, and it really is your little tiny finger and half of that forefinger. The thing is that you're getting a compression through through essentially where the tunnel is at the ulnar nerve at your elbow. And this sometimes will also require decompression surgery. This is often confused, though, with cervical radiculopathy. Cervical radiculopathy is a whole different issue. Cervical radiculopathy is because you've compressed a nerve in your neck, and these nerves follow a particular dermatome. And so sometimes a cervical radiculopathy will look like a C8 compression, which will overlap what a cubital tunnel looks like. And sometimes a cervical radiculopathy might be C6, might be C7, and sometimes that will overlap a carpal tunnel syndrome. And the therapy on these things is completely different, because you can't do a carpal tunnel reduction or decompression or a cubital tunnel decompression and hope to relieve the cervical radiculopathy. And the bigger problem is that we see often is that in a lot of injured patients, they may have one or both or all three. I've seen patients with all three, in cubital tunnel, carpal tunnel, and cervical radiculopathy. And these things can occur like that, especially if you have a lot of autoimmune issues. The critical element is to get appropriate diagnostic testing and to seek some care through somebody who can help you navigate through the difficult challenge of managing these issues. We have a checklist on how to manage cervical radiculopathy and kind of understand the difference. So if you click the link below, we can shoot out a checklist for you. This video is really intended for my patients because sometimes they have questions and they want to see the anatomy and they want to see what it looks like. So I thought I'd put this up on a video for them. But again, click the link below for a checklist on how to manage cervical radiculopathy and better understand this issue. Thanks so much. This is Dr. Padda.